This is the first of 6 of the mental health echo. I was asked just to sort of set the scene a bit by really talking about 2 things very briefly. First, the mental health network, or the IPWSO mental health initiative, and then secondly about the mental health echo and some of the principles behind the echo project. Some of you will have been part of other echoes and will be familiar with those principles, but I think it's worth setting those out at the beginning. But the IPWSO mental health network really started in 2021, and IPWSO set this up because over the years, some of the most common inquiries we get from people around the world are about mental health problems, about the behavior problems that families are trying to cope with. And I think increasingly we realize that these are some of the most significant challenges for people with Prader-Willi syndrome and for their families, and also for social care providers. And we're also aware that really it's probably the area in which there's the least support available to people, even in well-resourced countries. Having access to clinicians and others who may be able to help, it can be a real challenge. So the mental health network was really set up with 3 main aims. The first was really to try and define some of the problems that fell within this field of mental health and well-being. What do we mean when we talk about well-being, quality of life and mental health? And what do we mean by some of the behaviors of concerns and mental ill health that affect people with Prader-Willi syndrome specifically? The second thing that we set ourselves to do was to try and establish the state of understanding of why these problems occur. Why is it that people with Prader-Willi syndrome have the problem of hyperphagia or skin picking or whatever that takes us within the realm of behavior and mental health? And then ultimately to develop best practice guidelines informed by research that can then optimize how one supports someone with Prader-Willi syndrome to maximize their well-being and quality of life, and to prevent, detect and treat some of the mental ill health and problem behaviors that occur. Over the course of the mental health initiative, we had participants from 54 different countries, and they didn't come all the time, but we had really generally very good attendance. We met twice on the same day to try and deal with the time zone differences. And then we had a workshop before the conference in Limerick. This is just to say a little bit about the process that we went through and the outcomes of this diagram, which Brian in his talk is also going to use, just sort of tries to encapsulate some of the issues. So obviously issues of personal well-being and quality of life, the issues around how we understand some of the cognitive and communication and social problems that people with Prader-Willi syndrome experience, the behaviors of concern and abnormal mental states, and how that then leads to an understanding into intervention. So in summary, what I mentioned is we have in the report that we're preparing issues around definitions, around causation mechanisms, and around interventions and treatment. And the outcome of this initiative hopes to be a report, a rather large report that I'm responsible for at the moment, and I've been a bit slow, but it is making progress, which is essentially a consensus document. And then we'll have submissions to peer review journals and advisory papers for different stakeholders. But also one of the other outcomes from this initiative has been to establish the IPWSO mental health echo. So just to turn to echo briefly before we turn to Brian for the first talk, Project Echo was established and is based at the University of New Mexico in Albuquerque. And the Echo Institute set up its mission to, as they say here, democratize medical knowledge and get best practice care to underserved people all over the world. And it started to look at, it started initially because they recognized that there were people in the state of New Mexico that weren't getting treatment for hepatitis C. And really it's developed from these very physical conditions into areas such as autism, but we're one of the first, we're the second rare disorder to try and use the ECHO principle to promote knowledge about the condition, in this case, Prader-Willi syndrome. Their aim is to really reach 1 billion people by 2025. And one of their catchphrases is moving knowledge instead of patients. And the guiding principles that really are captured here by ABCD, amplification using technology to leverage scarce resources. And this was all before COVID. And that's remarkable. It's taken off with COVID, but this has been running many years before COVID. And we started just before COVID. Best practice, really sharing best practice to reduce health disparities. And we're very aware of the health disparities across the world for people with Prader-Willi syndrome. Challenge-based learning to master complexity. So that's where the challenges come in, and database outcomes to monitor the using of web-based tools. And another catchphrase is all teach, all learn. This is not about just about an expert talking about it. It's about us learning from each other, from people who may have very little experience to people who have a lot of experience. And we've had several echoes up until now. We had one we call our leadership echo, that were mainly parents from different countries across the world who we saw as leaders in those countries, a health echo, a social care providers echo, a Latin American one in Spanish, and now the mental health echo, which is focusing for care providers, clinicians and families. We're very aware that the mental health of people with Prader-Willi syndrome critically depends upon the well-being of the family or the well-being of the care environment where someone lives or where they work or whatever. As you'll be aware, the plan is to have monthly Zoom meetings with a didactic presentation, occasionally, as today, 2 brief presentations, and then a challenge that someone might present that might be an anonymized clinical challenge, or it might be a challenge about how to get services, how to develop services. It can be anything relevant to the mental health needs of people with Prader-Willi syndrome. We encourage group discussion and brainstorming, and then summarizing at the end for learning. But we want to emphasize right from the start that this is all our echo, and we really need your help, your guidance, and your input. We can't make it successful without all your help. These are the topics that we've chosen for the first 6 of the mental health echoes, and these are, you'll see the months that they will be occurring in. And finally, I think it's important, I think there's always a danger when it comes to mental health, is that people might have an image that if only they knew what it was, there is an easy or simple answer to these problems. There isn't an easy or simple answer, but what we, I think, do believe is that knowledge can make an enormous difference here. So sharing experiences is really important. And we see this mental health echo and the mental health initiative as the beginning of a journey of sharing experiences and knowledge, very much a global perspective. And we hope it'll be a catalyst for research and for advances in knowledge. So I hope that sets the scene a little bit in terms of this particular echo and the mental health initiative more generally.